Objective 15 says, describe the purpose and significant results related to diagnostic studies of the female reproduction function. Health screening guidelines. A pelvic exam should be performed yearly until age 70, and a bone density exam should be performed when the patient is 65 or older. A papilloma test, which is a pap exam, should start 3 years after becoming sexually active, but no later than age 21. When you assist with a pelvic exam, you need to be able to put the patient into the right positions and also talk them through the physical examination part. In box 5.1 in your book, it talks about assisting with the pelvic examination. Your job as a nurse is not to perform the pelvic examination, but assist the practitioner in doing so. Mammography should also be performed. Mammography should be performed with a baseline somewhere between 35 and 40, and then mammography every couple years after age 40. Cultures may also be taken of the vaginal vault area. Those results typically, preliminary results back in 24 hours, final results back in 72. Ultrasounds can also be performed to find things like cysts, fibroid tumors, problems with the ovaries. An MRI and CT scans can also be done. And then your job as a nurse is to help with both the internal and external reproductive examination. That information is located in chapter 5 in your book. Continuing on with objective 15, based on the diagnostic exam results, the nurse will provide education to the individual. The education provided to the women's health patient could include things like smoking cessation, appropriate alcohol use, prescription and non-prescription drug use, illicit drug use and help with breaking the habit of addiction, nutrition, obesity, nutritional disorders, exercise, stress management, safe sexual practices, and reproductive health should be performed as a part of a yearly physical examination. Objective 16 says correlate the effects on aging of the female reproductive function. What happens as we age is there are changes that occur to our body. Stress incontinence can be due to weakening of the pelvic muscles in multiparous women, and that is why it is important as women health care nurses that we stress the importance of Kegel exercises. Kegels, Kegels, Kegels. There's atrophy of the vulva, there's loss of subcutaneous fat, hair, and flattening of the labia. The vagina becomes pink and dry with a smooth, shiny appearance due to the loss of elastic tissue and rugae. This may cause dyspareunia, and so maybe you should encourage the use of different lubrications. The vaginal epithelium becomes thin and avascular. The vaginal environment becomes more alkaline. The cervix, the endometrium, fallopian tubes, ovaries, and uterus all atrophy. There's decreased estrogen production, which can lead to osteoporosis and lipid metabolism. And any postmenopausal bleeding should be immediately evaluated by the physician or healthcare provider. Postmenopausal bleeding is usually either some sort of cancer or trauma to the vaginal vault area after menopause. Perimenopause is the period of time around menopause. Menopause itself is the cessation of menstruation, and surgical menopause is where the menopause has been medically induced with the removal of the uterus, fallopian tubes, and ovaries. The physical changes during perimenopause is bleeding, especially at very irregular times, some genital changes, which we talked about previously on the slide, vasomotor instability, those are our hot flashes. What you can do for women and help the education for hot flashes is they should dress in layers. That way if they have a hot flash, they can take layers off, and when they get cooler after the hot flash decreases, they can put those layers back on. The other thing is the patient will probably have some mood or behavioral responses. Mood swings are not uncommon during perimenopause, and it is important for a woman who is in that area to know what they can do to help stabilize the mood. Some health risks for perimenopausal women: osteoporosis and coronary artery disease are both risk factors following menopause. Osteoporosis because we have a loss of bone density, and we have an increased risk of coronary heart disease because we've lost the estrogen, which is cardioprotective. So what patient education could the nurse provide to the clients concerning perimenopausal symptoms and health risks? One, they should continue to exercise at least 30 minutes per day. They should watch what they eat to decrease their coronary heart disease risk. They should do some light weight-bearing exercises for osteoporosis. They should have their cholesterol screened and then do interventions to decrease their cholesterol if it is elevated. Objective 17 is reviewing the menstrual cycle. The menstrual cycle, again, is in Chapter 5 in your book. The menstrual cycle is in Figure 5-8. Menarche is the first menstruation that a woman experiences. Menstruation is the periodic uterine bleeding that begins about day 14 after ovulation, and then again menopause is the final menstruation. Again, this is Figure 5-8 in your book. You can see there's 3 different cycles here. We have the hypothalamic pituitary cycle, which includes our pituitary hormones of FSH and LH. We have the ovarian cycle, which is dealing with the ovary, and that includes the hormones of estrogen and progesterone. And then you have the endometrial cycle, which is the building up of the endometrial layer and then shedding it with the menstrual period. FSH is follicle stimulating hormone that stimulates the egg to mature in the ovary. The surge of LH is actually what induces ovulation. Estrogen will build the endometrial lining so implantation can occur, and progesterone will maintain the endometrial lining. So those are the main 4 hormones in the menstrual cycle. When both the estrogen and progesterone decrease, that is when the ischemic phase happens and menstruation begins. So again, the hypothalamic pituitary cycle, FSH again stimulates the ovary to mature one follicle. LH stimulates ovulation. In the ovarian cycle, the follicular phase begins with menstruation and ends with ovulation. The luteal phase begins with ovulation and ends with menstruation. And then there are 4 phases in the endometrial cycle. The menstrual phase, which there is shedding of the endometrial lining. The estrogen levels are low. The cervical mucus is very scanty, thick, and opaque. The proliferative phase, where the lining of the uterus thickens, the estrogen levels increase and peak just before ovulation. The cervical mucus becomes more plentiful, thin, and stretchy. The secretory phase, when the estrogen levels drop and progesterone levels rise, the blood supply increases into the endometrium. And the ischemic phase begins if fertilization and implantation do not occur. So the corpus luteum in the ovary disintegrates, the estrogen and progesterone levels fall, and menstruation begins. Objective 18 describes significant subjective and objective assessment data related to female reproductive function. What type of subjective data would be significant? Again, if they're doing their breast self-exams. Again, breast self-exams should occur 1 week after the menstrual cycle. And if they are no longer menstruating, it should be on the same day every month. When their last menstrual period began. Are they having any bleeding or bleeding issues? Have they noticed any masses or lesions? Are they having any pain? Have they had an inability to achieve pregnancy, and are they using any contraceptives? What type of objective data would be significant? Again, bleeding, masses, and pain. Remember, objective data is things that you can observe. Objective 19, Anatomy and Physiology of the Female Reproductive System. These are on VoiceOver PowerPoints already located in Unit 2.